Welcome to The Explainer. Today, we're jumping into a fascinating medical mystery. It's one that starts with our eyes, sure, but the solution is found deep inside our brains. We're going to be cracking the code of vision loss. So just imagine this for a second. You're walking down the street, and all of a sudden, everything to your left, or maybe to your right, just vanishes. It's not blurry. It's just gone. Like a perfectly cut piece of your world is just missing. What do you even think is happening? Well, this isn't some trick of the light. It's actually your brain sending you a very, very specific signal. It's a clue. And if we can learn how to read that clue, we can trace the problem all the way back to its source, along the incredibly complex wiring that connects your eyes to your mind. So yeah, let's follow the evidence. Okay, so our main clue has a name. A visual field defect, or VFD for short. Now, this isn't a disease itself. Think of it more like a signpost, a really important one that points to an underlying problem somewhere. And the key thing to get here, the absolute most important part, is that the specific pattern of vision loss tells us everything. It's what tells us exactly where to start looking. So to solve this mystery, what do we need? Well, we need a map. And for us, that map is the brain's visual pathway. This is the exact route a signal takes from the moment light hits your eye to the very instant your brain puts together an image. All right, let's trace this journey. It all kicks off when light hits the retina, which creates an electrical signal. That signal zips down the optic nerve from each eye and heads to this really crucial intersection, the optic chiasm. Now, this is where the magic happens. Some nerve fibers cross over to the opposite side of the brain, but others stay on the same side. After this big crossover, the newly sorted information keeps going through the optic tracts and radiations until it reaches its final stop, the visual cortex. That crossover point, that's the secret to cracking this whole code. Okay, so we've got our map. Now we can actually start to figure out what these clues mean. The pattern of what you can't see tells a neurologist precisely where on that map the problem is. And this is where the logic is just so elegant. Think back to that big crossover, the optic chiasm. The fibers that cross over, those are the ones that handle our peripheral or outer vision. So if you have a lesion that hits that exact spot, you lose the outer fields of vision in both eyes. That's called bitemporal hemianopia. But what if the damage happens after the crossover, maybe in the optic tract? Well, at that point, all the fibers for, say, the right side of your world are already bundled together. So a lesion there knocks out the same side of vision in both eyes. The location of the damage creates a perfectly predictable blind spot. It's pretty amazing. And doctors, they have these clever little tricks to remember all this. See, the fibers fan out as they travel to the back of the brain, and they loop through different lobes. The lower loop, that's Meyer's loop, goes through the temporal lobe. If that gets damaged, you lose the upper quadrant of your vision. The little saying for it, Meyer's loop gives you pie in the sky. And the upper fibers, they run through the parietal lobe. Damage those, and you get pie on the floor. It's a surprisingly simple way to keep a really complex map straight. Okay, so we know how to read the map. We know how to locate the scene of the crime. Now, it's time to identify the culprits. What actually causes these lesions? Let's look at the whodunit of visual field defects. Let's try a quick case together. We've got a 68-year-old woman. She says she's having trouble seeing people coming up on her from either side. An exam shows she has bitemporal hemianopsia, so loss of the outer fields in both of her eyes. Based on our map, where's the lesion? And what do you think might be causing it? If you guess the optic chiasm, you are spot on. And what sits right underneath the chiasm, in the perfect spot to press on it if it starts to grow? The pituitary gland. So the most likely diagnosis here is a pituitary adenoma, a type of tumor. The visual clue pointed us directly to the right answer. But tumors are just one of the usual suspects. Honestly, the list of potential causes is long, and they can be incredibly different from each other. You could have something sudden, like a stroke cutting off blood flow, or something really slow and progressive, like the pressure buildup from glaucoma. It could be inflammation from a condition like optic neuritis, which we often see with MS, or even that weird, temporary, shimmering vision loss you can get with a migraine aura. Each one leaves its own kind of fingerprint on your vision. which is why a doctor has to look at the whole clinical picture to solve the case. But, just when we think we've got it all sorted out, there's a plot twist. Sometimes, a patient acts like they can't see one side of their world, but their entire visual pathway is perfectly fine. This is where we have to tell the difference between actual vision loss and something else entirely. This imposter is called visual neglect. With a true field defect, the brain gets no signal, and the patient usually knows something's missing. But with neglect, the signal arrives perfectly fine. The brain's attention center, though, usually after a stroke, just ignores it. The wild part is the patient is completely unaware they're missing half their world. A classic test for this is asking them to draw a clock. They might draw a perfect circle, but then they'll cram all the numbers 1 through 12 onto just the right-hand side, leaving the left side totally blank, as if it just doesn't exist. So why is solving this whole puzzle, telling apart a true field cut from neglect, and finding the exact cause, why is it so incredibly important? Well, because it has massive, real-world consequences, especially for something a lot of us do every single day. Let's talk about driving. The rules are, and they have to be, incredibly strict. Whether that's a mandatory no driving period after a stroke or being disqualified for a persistent blind spot, it's all about safety. Someone with neglect, who is literally unaware of their deficit, is a clear danger on the road. This isn't just about a medical diagnosis. It's about making sure the patient and everyone else on the road stays safe. That's why getting the right diagnosis and management plan is so critical. So the next time you look around, just remember that what you see is the end result of this incredible neurological journey. Your vision isn't just a window to the world. It's a window into the health of your brain. The patterns, the glitches, the blind spots, they're all part of a code, a constant stream of information that, if you know how to read it, can tell a truly remarkable story. So what is your vision telling you?